The next case is a case of a 35-year-old computer programmer who has been complaining of waking up from sleep almost every night with the numbness of his hands, which improves by shaking the hands. He also says opening a jar of a peanut butter is getting more difficult day by day. His past medical history is unremarkable and he's in great shape. He takes glucosamine, resulting in minimal improvement. On his physical examination, his test positive for Tinel's sign. Tinel's sign is essentially tapping over the wrist and carpal tunnel region, resulting in tingling and pins and needles sensation of the fingers. Ultrasound examination confirms the diagnosis of carpal tunnel syndrome. Carpal tunnel syndrome occurs when the median nerve, which runs from forearm into the hand, becomes pressed or squeezed at the wrist. The median nerve controls the sensation to the palm side of the thumb and fingers except for the fifth finger. The carpal tunnel is a narrow, rigid passageway of ligaments and bones at the base of the hand which contains the median nerve. Sometimes thickening from irritated tendons or other swelling narrows the tunnel and causes the median nerve to be compressed. The result may be pain, weakness, or numbness in the hand and the wrist, radiating up to the arm. Although painful sensations may indicate other conditions, carpal tunnel syndrome is the most common and widely known of the entrapment neuropathies in which the body's nerves are compressed or traumatized. Symptoms of carpal tunnel syndrome start gradually and with frequent burning, tingling, or itching and numbness in the palm of the hand and the fingers, especially the thumb and the index middle fingers. The symptoms often first appear in one or both hands during the night. Since many people sleep with their wrist in a flexed position, it is very common for the patient to wake up in the middle of the sleep feeling the need to shake out the hands and the wrist. As symptoms worsen, people might feel tingling and pins and needles during the day. The risk of developing carpal tunnel syndrome is not just confined to people who use a computer, but it is also common in those who work in the assembly line and manufacturing, sewing, fishing, cleaning, and playing musical instruments. Treatment include rest, ice, wrist supporters, elevation of the wrist, anti-inflammatory, and injections. Surgery helps in cases that conservative measure fails.